Hi, everyone. I'm Dr. Leila, a urologist and men's health specialist with more than 30 years of practical experience guiding people through the highs and lows of aging. Throughout my career, I have delved deeply into the ways that our bodies change with time, concentrating on hormones, relationships, and that glimmer of life that keeps us going. And let me tell you right away something that should be shouted from the rooftops but is rarely discussed in doctors' offices. If you have let your masturbation to diminish as you've aged, your body may be paying a silent, unseen price. It's about actual, palpable effects on your prostate, your heart, your brain, your sleep, your immunity to disease, and even how you look in the mirror every morning. It's not simply about losing out on a little of the fun you had when you were younger. Ignoring this is not innocuous. It can lead to problems that rob you of your freedom and happiness. The good news is that I'm here to shed light on everything using sound research and years of patient testimonials so you can take back what is rightfully yours. If you stick with me, you might wind up having a completely different, more positive perspective on your own body. Before we get started, click the subscribe button and enable notifications if you're determined to remain alert, active, and in charge as the years pass. I write these insights specifically for people like you, real discourse about aging well. And if this speaks to you, leave a brief yes in the comment section below or share an opinion. Otherwise, a straightforward no also works. Your comments influence what I say next, enabling us to all work together to promote greater pleasure and health. Let's start with one of the most underappreciated yet important consequences: how neglecting to masturbate in later life might subtly impair your urinary and prostate health. When I began practicing urology over 30 years ago, I was taken aback by the number of elderly patients who confided in me about the slow disappearance of their sexual behaviors. Although they didn't flaunt about it, it was essential to their health. There was a man in his mid-70s who sat across from me in my office. He was fit and sharp as a point. He acknowledged that he believed he was past that side of life. But he was tired and frustrated, waking up 4 or 5 times a night to urinate. He didn't understand, and so many guys do not, that ejaculating on a regular basis, even for self-gratification, is similar to your prostate's normal maintenance regimen. Consider your prostate as a busy factory within your body that is actively creating fluids, expanding and contracting to maintain the flow of blood. If you ignore it, those fluids may accumulate and become stagnant, which will encourage swelling and inflammation. That accumulation eventually presses against everything nearby, resulting in a weaker urine stream, a heavier feeling bladder, or the persistent feeling that the bladder is not emptying completely. These are warning signs rather than minor irritations. It can progress to benign prostatic hyperplasia, BPH, which affects almost half of men over 60 if untreated. Urinary retention, frequent bladder or urinary tract infections, and in extreme situations, the necessity for surgery or a catheter are all possible outcomes from there. That patient I spoke of, he ultimately needed a treatment to release the pressure, which may have been avoided with regular easy routines. This is supported by research. Studies, such as one from Harvard, indicate that men who ejaculate 21 times or more per month had a 1/3 lower risk of prostate cancer than those who ejaculate less frequently. This is about using your body's natural biochemistry to defend you, not about going overboard or pursuing some wild youth. Because they can't trust their bladder, I've seen proud, active men in my clinic begin to fear social situations or long journeys. Sleep and the sensation of independence are undermined by the creeping dread of the night. The fact that it is frequently avoidable makes it tragic. Frequent self-stimulation maintains things toned, flushes out those fluids, and lessens accumulation. Here's a personal story from my early days. I had a retired teacher who, on my guidance, added this to his regimen and reported feeling more confident and having better flow. "Doc," he replied, "it's like I got my life back." And that's the main point. Maintaining your dignity and individuality is more important than merely avoiding suffering. However, the effects don't end at the prostate. They continue all the way up to the brain. Please leave a brief comment letting me know you're engaged if anything I've said so far resonates with you. You might even share a similar story. It sustains the discussion. The second significant consequence is that giving up self-gratification can impair your cognitive edge and mental acuity. A guy in his early 60s visited me just last year because he felt off kilter. not because of problems with his urine. He continued, Dr. Leila, I enter the kitchen and don't know why I'm there. My mind wanders in the middle of a phrase. Is this simply growing stale? I used to be the smart guy at work. I get asked this more often than you might think. And although age does naturally alter our brains, few people are aware of how closely masturbation and other forms of sexual activity relate to maintaining the smooth operation of those brains. To put it simply, your brain releases a variety of feel-good chemicals during arousal and climax, including cytokines that strengthen neuronal connections, serotonin for mood stability, and dopamine for attention and reward. This spike helps create stronger memory pathways, protects against stress chemicals like cortisol that gradually damage neurons, and increases blood flow to important brain regions. Regularly skipping this will reduce the protective benefits. At first, it's minor, lost keys here, missed appointments there, but it can escalate into serious annoyance, such as finding it difficult to focus on a book or losing interest in everyday chores. In my experience, this also has to do with changes in hormones. Without sexual pleasure, testosterone, which aids in motivation, memory, and decision-making, decreases more quickly. I have worked with guys whose stopped habits were reflected in their low T levels, creating a vicious circle of fear and mistrust. Although it's not a direct cause of diseases like dementia, new research ties seniors' decreased sexual activity to increased odds of early cognitive decline. It's more like leaving your brain susceptible without its natural protection. An example that comes to mind is when one of my old engineering patients quit his weekly puzzle club due to his inability to concentrate. Within months after we talked about reestablishing a connection with his body, he reported thinking more clearly. When he told me, it's like the fog lifted. Think of it like a muscle that diminishes if you don't flex it. That resilience-boosting stimulation is what your brain longs for. A simple private habit could rekindle the spark of self-doubt, which unfortunately many people fall into because they believe it is inevitable. However, cerebral fog is only one layer. It frequently contributes to something even more pernicious: unannounced emotional apathy. Let's go on to the third effect, which is how ignoring intimate relationships can subtly cause despair and a severe emotional plateau. I had a widower in his 70s who sat in my exam room, looking hollow, although he was fit for his age and had a comfortable retirement. He confessed, Doctor, I don't feel much anymore. Not depressed, not joyful, just empty. Does aging feel like this? It's heartbreaking because what is written off as normal frequently has deeper physiological foundations that we are reluctant to talk about. His words are echoed by a lot of others I've heard. The unvarnished truth? Self-pleasure is an emotional reset button, not just a physical relief. The bonding hormone oxytocin and endorphins, which are released during orgasms, function as natural antidepressants, producing anxiety and boosting mood. Emotions might become dull to a grayscale existence without this outlet, particularly in the midst of life's stressors like bereavement or loneliness. I've seen it happen. After a partner dies or society says, it's not for your age, patients retreat, their hobbies wane, their talks become less frequent, and a silent sorrow descends. Depression is underdiagnosed in older persons because it frequently presents as impatience, exhaustion, or apathy rather than open weeping. A seasoned patient once described how returning to self-touch after years of abstinence brought color back to my days. This was a particularly memorable experience. He wanted to feel like a human again, not chase thrills. According to studies, seniors who engage in frequent sexual activity have decreased rates of depression, most likely as a result of stress reduction and hormonal balance. In terms of empathy, I understand that sadness or shame might obstruct the way, but regaining this is similar to caring for a garden. If you ignore it, isolation weeds will develop. Developing your emotional core for survival is more important than trying to force happiness. Additionally, sleep frequently follows emotional flattening, which has a cascading effect on your general vitality. Tell me you're reading and following along by taking a moment to post a comment if these ideas are hitting home for you. More of this is fueled by your involvement. Let's now examine the fourth consequence: how not having enough sexual release can disrupt your sleep, causing you to wake up during the most critical times for rest. Imagine this. A man in his 70s who used to be an athlete walks into my office looking as though he hasn't slept in weeks. He said, I sleep well, but I wake up around 2 in the morning with a racing mind and a tight body. Tests reveal no red flags or sleep apnea. Gently probing, he acknowledged that his private life had retired years prior. He had no idea that it would be the final component needed for a deep, healing sleep. Orgasm leads a brilliant climax to the hormonal symphony that is sleep. It increases endorphins for relaxation, decreases cortisol for calm, and raises prolactin for slumber. It's nature's lullaby. Your muscles relax, and your heart rate evens out. If you ignore this, your body will not receive the wind down cue, which could result in disjointed nights and a sluggish day. Chronic lack of sleep. It weakens immunity, increases cardiac risks, impairs cognition, and causes falls. I've witnessed energetic people withdraw from life out of sheer fatigue. After practicing self-care in the evening, one patient grinned and said, "I sleep like I did in my 40s, solid 7 hours." It's biology, not magic. Instead of using this natural tool, many people blame it on aging and take drugs. Consider this if you have restless nights. When was the last time your body completely relaxed? Regaining the ability to turn exhaustion into energy? However, sleep deprivation exacerbates bodily problems, such as the fifth problem, which is weakened pelvic floor muscles and slow blood flow. I worked with a robust, tank-built retired firefighter in his 70s who complained of low back pain and small pee leakage. "Feels like my foundation's crumbling," he replied. You're right. Exercising is essential for the pelvic floor, the hammock of muscles supporting your bladder, bowels, and other organs. These muscles flex rhythmically during sexual stimulation, increasing nerve responsiveness, suppleness, and circulation. Without it, atrophy develops. Imagine erectile dysfunction, recurrent cravings, or leaks on a cough. Women also experience discomfort or dryness. I've seen patients lose their dignity by limiting their activities due to bladder mistrust. Regular arousal maintains tone and lowers the likelihood of incontinence, according to research from pelvic health studies. A moving account of a widow in her late 60s who had experienced menopause and felt betrayed by her body before finding courage through careful self-examination. Her words, "I walk taller now." It's similar to core exercises. If you neglect it, your stability will suffer. But this has to do with your defenses, not your muscles. The sixth hidden cost is how a lack of sexual activity can gradually weaken your immune system, leaving you more vulnerable to illnesses ranging from colds to long-term problems. A typically healthy 70-year-old patient, beaten by recurrent illnesses, came in during a hard winter. "I bounce back slow now," he said. I asked him about intimacy after ruling out the fundamentals, and he laughed, saying, "That ship's sailed." However, that is the exact point at which his fortitude may have weakened. Endorphins reduce inflammation, while orgasms release immunoglobulin A and other immune-boosting chemicals that protect against infections. Activity-induced hormonal balance maintains circulation high and stress low, which is essential for heart disease or cancer prevention. Stronger immune markers are linked to frequent ejaculation, according to studies, including one in psychoneuroendocrinology. Vulnerabilities increase in the absence of this, particularly as aging gradually weakens defenses. After years of widowhood, one woman reported feeling less unwell and rekindling her self-touch. Or her words, "My body's fighting back again." It's your cells receiving a vitality signal, not a lot of fanfare. Action, not shame, should stop this. The seventh and possibly most significant is losing the physical connection to oneself, which erodes one's sense of ownership and value. The statement, "I don't feel at home in my skin anymore, just occupying space," was made by a retired principal in his late 60s. Since touch was dismissed as irrelevant in later life, it has become a recurring refrain. Pleasure with oneself reinforces one's presence. I'm here. I matter. Without it, detachment increases, resulting in diminished self-care, avoiding mirrors, and ignoring needs. I've witnessed it cause extreme numbness and a decline in vigor. Resuming touch, according to a patient after a divorce, made me feel whole again. Honoring your enduring self is more important than trying to reclaim your youth. Putting everything together, the silent losses I've experienced in my 30s and beyond, from brain fog, insomnia, melancholy, pelvic weakness, prostate issues, immunological declines, and diminished self-esteem aren't just aging. They are requests for reconciliation. I've seen people undergo changes. They regain clarity, vitality, and joy. They restore closeness both alone and with others. It's not luxury, it's necessary care. Please like, share, and comment if this resonates with you. Your story may inspire others to take action. Your body is waiting for you to begin today.